Hi everybody, thanks again for joining me. Hunter Winklepleck here. For my presentation, I wanted to discuss my industry of long-term care. So with my presentation, the goal of my presentation is to describe the industry of long-term care in a way that the viewers can have sort of a high-level understanding of the different industries that we have within long-term care, my specific role as a facility administrator of a skilled nursing facility, and what some of the challenges and rewards are in relation to long-term care. So as we go through, if you think of questions that you might have, I encourage you to email me. It's going to be a lot of information in a short amount of time, so thank you very much for joining me today. I really appreciate it. To start, one of the things that I like to ask anytime I talk about long-term care for a new audience is, what does long-term care mean to you? For a lot of people, and for myself before I got into long-term care, what long-term care for me was a nursing home. People went to a nursing home, rolled around in their wheelchairs, and really didn't do much else besides, live in this place. That was until I went to the University of South Dakota and majored in Health Services Administration. You were required to take a class called Gerontology and Long-Term Care. And in that course, I really discovered the different aspects that go into long-term care and how it's really evolving past just that nursing home into a more everyday life, even going as far as keeping those people at home to make sure that they are as comfortable and as healthy as possible within a safe setting. So you'll see I have attached in the link to the forum a presentation. If you want to go ahead and open that, if you haven't opened it already, you can pause the video and open that up. That's what I'm going to be using to follow along in this presentation. So to start, one thing I want to discuss first off is just nursing facilities. I think that's the one that most people are aware of. That's going to be your skilled nursing facilities and just kind of the special characteristics of a nursing facility. They're licensed by the state in which they reside. So each nursing home has to have a specific license. Here in South Dakota, we're licensed by the South Dakota Department of Health. Each specific state's Department of Health is the ones that pass out those licenses. You can be certified by both Medicare and Medicaid. If you want reimbursement by either of those sources, you need to be surveyed on an annual basis, and we'll talk about that in a little bit. They're overseen by both the state and the federal government. So the state oversees your Medicaid, and the federal government oversees your Medicare. You may admit and retain those that require nursing care from a licensed nurse, either being a registered nurse or a licensed practical nurse. You must have a medical director who must be a physician that must be staffed or at least contracted with you to oversee your care, persons that you can write orders to because nurses can't necessarily write those orders. And then it must be staffed with licensed nurses, and they really look at that heavily. We actually have to submit our data for our staffing to Centers for Medicare and Medicaid Services website. And it's an extensively regulated industry. When we talk about challenges and rewards, that's one of the things that we'll discuss. But a fun fact, it's actually the second highly most regulated industry in the United States, only behind nuclear power. So you would think that necessarily wouldn't be the case with all of the other agencies that we have within the United States, but long-term care facilities that are licensed by the Centers for Medicare and Medicaid Services are the second most regulated industry in the U.S. The second one that you probably heard of is assisted living centers. Those are also licensed by the state, but those provide personal care and services beyond your basic food, shelter, and laundry for those that don't necessarily need skilled nursing services, but do still need some sort of assistance. You can admit and retain those who do not require more than intermittent nursing care. Now that's important. That's things that have to do with medication administration, perhaps getting ready for the day, assistance with those activities of daily living. But those skilled nursing services like dialysis, diabetes testing, and then also catheter cares, things like that, those cannot be administered within an assisted living facility. You can provide home health agency services for the short-term skilled. And licensure may include specific approvals to go outside of just that intermittent nursing care. So like I said, medication administration, care for the cognitively impaired. You can have a memory care, assisted living. care for the physically impaired, so those who might need minimal assistance with their activities of daily living, oxygen administration, therapeutic diets if somebody needs to have pureed foods, assisted livings can help with that, and their care for residents with hospice. Now this is actually a new change. So when you're talking about hospice care, that's usually towards the end of life, someone who's needing a lot of assistance with their day-to-day cares. There's going to be a push to home, in which I'm going to discuss a little bit later, and that really means keeping people out of nursing homes, because it is very expensive for people to live in nursing homes. So that question that I have listed there, why do you think assisted living centers can have these kinds of services? Well, it's much cheaper to offer them within an assisted living setting. Medicare doesn't like paying for expensive items and expensive care within a nursing home. So there's a huge push to keep people out of nursing homes. That's a very big challenge for us in the skilled nursing facility world. A couple of ones that aren't necessarily known that well are adult foster cares and residential centers. So adult foster cares are just family residents licensed by the state, in which the aged, the blind, the physically impaired, cognitively impaired, developmentally disabled can go and live in a safe place, much like residential living centers, but those do not need to be licensed by the state. They're for 2 or more elderly or disabled persons not related to the owner of the facility, because that would just be a home, in those senses of the word. You can admit and maintain people who do not require more than meals, room, and activities of daily services. So one step below that assisted living, and even a couple to a few steps below that in skilled nursing. Another one would be congregate housing or independent living. And if you have questions about any of these, I got all this information from the South Dakota Department of Health website, and they explain this a lot very well in case you're looking for something for a loved one of your own. So assisted living, independent living environment to the elderly or handicapped who may be functionally impaired, socially not developed, but otherwise in good health, not acutely or physically ill is going to be the most important aspect of the congregate housing. Independent living, on the other hand, offers residential accommodations, central dining, and related facilities that support the services for a person to be able to live on their own. So they're really not getting any help with medication administration. They're really not getting help with their activities of daily living. What they are getting, it's more of an apartment complex in which they have a central dining and some more services like activities, to help really feel like more of a home within this apartment setting. One of the most fastest rising industries in the long-term care world is home health agencies. Now, home health agencies have a couple different parameters. So you could be a home care agency or a skilled home health agency. A home care agency doesn't need to be licensed by the state, but it's much like assisted living in the sense that you can't provide those skilled nursing care within the person's home. Home health agencies, on the other hand, are licensed by the Centers for Medicare and Medicaid Services and is reimbursed through Medicare. And with home health agencies, you can have those skilled nursing facilities take place within the home. Now, the South Dakota Department of Health is really pushing for people to use home health agencies. So it's a major challenge for myself as a nursing home administrator, because I'm now expected to send home my Medicare residents who are there for therapies home sooner with home health, because again, it is much less cheaper than keeping them within a nursing home. So if you follow along on the slide presentation, we're just going to talk about nursing facilities now, because that's where my expertise lies. I'm the administrator of a skilled nursing facility. So following along, going on to the next slide, the positions within a nursing facility, I think it's always interesting to think, of course you think about nurses and certified nursing assistants when you think of a nursing facility, but there's actually a lot that really goes on into the, meat of operating a nursing facility. So you have your department head. So the administrator is the overall lead of the facility, making sure that day-to-day activity is being done in a proper manner according to regulatory compliance, and then looking at the overall vision of the facility and the organization. Then you'll have your director of nursing, who is in charge of course, your nursing, your nurses, your CNAs. Then your environmental services director, the maintenance, housekeeping, laundry, those day-to-day things. The social services director, so we're required to have a social worker on staff, or at least have a contracted social worker to provide those services for our residents. Oftentimes when a person transitions into a nursing home, it's a very stressful time for them. So having that social worker there can really provide support for them. Dietary director, obviously that's one of the most important things within a nursing home, is making sure that our residents are adequately nourished to keep them healthy. And then a life enrichment coordinator or activity director. That person is really going to help get our residents active and make sure that they have a fulfilling day-to-day lifestyle. We don't just want our residents to stay stagnant in a nursing home, not having anything to do except watch TV in their rooms. We want to make sure we're offering music therapy. We want to make sure that we're offering community members, especially local churches, to come in and really get to know our residents. Other positions obviously would be billing coordinators, contracted therapy staff to deal with our physical therapy, occupational therapy, and speech therapy, and then consulting dietitians, consulting pharmacists, our medical director, and then other contracted physicians that work with our residents who come in and do rounds in our facility. Moving along, the different payment structures that go into a long-term care facility. You have private pay, Medicare, Medicaid, and then long-term care insurance. Private pay really is what we try to focus on within a nursing home. As a business, that's kind of your gravy. So the individual pays out of their pocket to receive services within that facility. Medicare, on the other hand, is reimbursed through, obviously, the Medicare services, Title 18, through the federal government, and that pays for individual stay after an inpatient hospital stay. So let's say a person goes to the hospital for a fall and they break their hip, they're there longer than 3 days. Medicare will now pay for their stay up to 100 days. Right now, we're going through a major change as far as regulations are concerned because our fee-for-services model is being replaced by a quality-driven model in which the quality of care that we receive is how we're going to be reimbursed. So the more quickly we can get that patient through their therapy and hopefully back home and keep them out of the hospital, the more we're going to be reimbursed. So that's going to be an interesting transition. Medicaid is reimbursed through the state. That's our highest referral source because obviously as you get towards old age, people start to run out of assets and they need that assistance to be able to receive the care they need. Currently only getting reimbursed at about 90% of our costs though, so it's very challenging to maintain a positive bottom line when Medicaid is your most highly reimbursed payer source. And then long-term care insurance are just private insurance policies held by the resident themselves, who is reimbursed and helps pay for that resident's stay on a day-to-day basis, repaid on a per diem rate. Regulatory oversight, as I said, is a major challenge. 700+ regulations created by CMS. This is on the next slide. And more state-specific regulations based on what state you're residing in. So you're surveyed every 9 to 15 months. Otherwise, you can be surveyed as a complaint if a family member calls in or somebody calls in saying, I don't really like what's going on in the facility. The surveyors can come and survey your facility. Now, obviously, the surveyors that we have in the state of South Dakota are from the State Department of Health. Excuse me. But then we also can be surveyed by our federal regulators out of our Denver offices and our regional office. And I've actually experienced both a state survey and a federal survey. And they are both very intense processes. They'll come in and look at all of the documentation you have and make sure that you're really taking good care of your residents. Going to our next slide, the survey process. We just had a new one start in November of 2017. And it's very resident focused. I put it 3 times there on that next slide. Resident focused, resident focused, resident focused. They go and interview your residents and they'll watch the cares that you give to your residents to make sure that you're following the resident's care plan. They'll ask for your policies and procedures. So let's say you're helping a resident use the restroom. They'll ask for your policies and procedures on how to actually do that, and they'll watch you if it's okay with the resident to make sure that you're following those policies and procedures to keep the resident and the staff safe. You can receive deficiencies if regulations are not met or if staff are not following the policies and procedures. So the most important thing, you obviously need to know your facilities, your policies and procedures, your employees, but most importantly, you need to know your residents. And that's been a big push in the last 5 years, is to be very resident focused. A lot of the times, you have the opinion of nursing homes where the residents just roll around the nursing home. And they're not really taken seriously as an individual. That's a big change that we really try to focus on in nursing homes now, is knowing who this individual is, not only at the nursing home, but who were they before the nursing home? What did they like to do before? what did they do as a career? Really getting to understand that person on many different levels. So now we'll transition into the challenges and rewards. So starting with the challenges, obviously regulatory oversight is a huge challenge. Trying to meet the needs of all of those different regulations is a very challenging and very financially hard thing to accomplish as a nursing home administrator. HR, as an administrator, especially when I was an administrator in a small facility, you are the HR. Dealing with those day-to-day employee problems can be a major challenge. Dealing with the needs of each individual resident, but then also their families. And I think this is something that people don't necessarily know a lot about, but one of my biggest challenges has been dealing with the individual family members of my residents. The families can have just as high as expectations as the residents, and sometimes families don't get along with one another, leading to some very interesting dynamics. Like I said, the push to home is obviously a very, very challenging thing for myself as a skilled nursing facility administrator, because I'm losing my referral source there. So trying to figure out how we can work within those confines is what my goal is now over the next few years. And then end-of-life care. That's one of the most unfortunate things about dealing with long-term care, is that most people that come to a nursing home will usually spend the last days of their life there. So knowing how to properly deal with that and having our staff be prepared to help our residents and their families through that is very important. The rewards that I found in my time as an administrator, the biggest one is the ability to form long-lasting relationships with the residents of my facilities. So I thought about becoming a hospital administrator, but when I did my internship at a nursing home, I just found that the ability to see those residents each and every day really helps you form those long-standing relationships that are going to be very important to you. For an administrator like myself, one of the very nice things coming out of school was that I didn't need a master's degree to initially get a long-term care administration. It was a great opportunity for me to get management experience as a very young professional, and I think that's been very rewarding for me, and I've learned a lot in that. So just in conclusion, I hope this was an informative presentation for you. Like I said, I really just wanted you to have a high-level understanding of just the different types of long-term care that there are, my work as a nursing facility administrator, and then some of the rewards and challenges that go into long-term care. If you have any questions at all, like I said on that last slide, please send me an email. If you have questions about long-term care for a loved one, send me an email. I'd be more than happy to answer any questions for you. But thank you for tuning in today, and it's been a pleasure working with all of you in this course. Thank you very much.